So hi, this is Mary Kurek, and I'm with Frontrunners Innovate magazine, as most of you know who are watching now. Today we are with John McNulty with Didgebridge, and this edition of the magazine is focusing around innovations on mental health and in the memory disease spaces. And what we love about what Didgebridge does is it brings a twofer. It brings that education piece and the sort of adherence to prescriptions and the value of being able to be reminded and to be able to get that little check mark in the box of I'm doing the right thing all the way along through my treatments and my healing and that sort of thing. I want John to give you the sort of the backstory of Didgebridge, how it came along, and a little bit of his background that points to that. So John, thank you for joining us today. And so why don't you go ahead and give us a little backstory on this?
Yeah, hey, it's very nice to meet everybody today, and Mary, certainly appreciate your time, particularly during a holiday week here, where there's a lot going on with everybody. But like who is Didgebridge? We are a patient or consumer focused mobile communication technology company, and our main point of differentiation, as I like to describe it, is we specialize in enabling, creating one-to-one private mobile video communication education networks. And we're quite focused on the very broad health and wellness category. I'll describe it that way, not just healthcare, but health and wellness, which now encompasses mental health, opioid abuse, etc. So that's a little background on our company. We back in 2015 is kind of the start date, I would say. We at that time we were speaking at universities around the country on what we saw the future of the public internet communication ecosystem, which we thought was quite broken from a privacy perspective, and we thought it was particularly broken in healthcare. And we were speaking at a large university, and Microsoft happened to be in the room. Microsoft was intrigued by what we were talking about, our focus on privacy protection and our focus on mobile video education. And they suggested that we get together and maybe think about a more formalized collaborative relationship, which we did. And so since 2015, we have been accelerating our collaborative relationship with Microsoft. We're now working at very high levels, executive levels within Microsoft's technology and healthcare organization. And we're very, very focused on patient, consumer, private, mobile video education and prescription regimen adherence.
So John, I'm going to be stupid about this. When you say mobile, I think, of course, the phones, iPads, that sort of thing. Is this app related? Tell me how that works.
No, it's not. No, that's a great question. One of our core areas of competency is actually cybersecurity. Okay, and there's two components to cybersecurity. One is kind of enterprise level cybersecurity. We call that the back door, to keep the North Korean hackers out of our stuff, our electronic medical records and so forth. But the front door, what we're all finding out, which became very apparent in 2016, courtesy of Cambridge Analytica, the front door is wide open. Now, the front door is the public internet communication ecosystem. And your question about an app, we are not app-based. Okay, we allow consumers or patients to access web content, okay, through telecom, okay, because telecom does not merge with the public internet ecosystem, and we do not use apps because most apps, they're going to ride on Android, and if they ride on Android, you're not quite sure whether that data is being mined or not. That's the unfortunate reality of it. So we do not use app. We are telecom based. We find that telecom is the most secure and private pathway to the public internet ecosystem. And the way we do it, it's coded in such a way that the bad guys, the web crawler bad guys that are mining all the data, they cannot access our IntelliSmart microsites, which look like websites. They have integrated, you know, prescription regimen, education, video tutorials, but the bad guys cannot mine the data on us, which is very, very important.
I think it's important for any patient, but particularly I think in the health and wellness space, as you look at mental health and some of the aging related diseases, not particularly aging related, but you know, you think of Alzheimer's, you think of dementia and things like that, really sensitive data to be having running around out there. Tell us how the value that you bring toward that space particularly.
Yeah.
Give us a scenario, paint us a picture.
Okay, I'm going to give you a scenario. Okay. There's some interesting, I'm going to give you a couple of factoids, and I'm going to give you kind of a real world scenario that all of us can relate to and all of us should be cognizant of. Okay. Here's some stats regarding healthcare in America. Okay. 50% of all prescriptions for chronic conditions, where it's very important that you follow the regimen, 50% of them are not followed. And a lot of those are mental and emotional health challenges. Okay?
People with
a lot of
depression, antidepressants and things like that.
Absolutely, because we are in the midst of right now an anxiety pandemic. You know, one of the things that is not debatable, there's a lot of things that are debatable about COVID-19, but one of the things that is not debatable is that it has exacerbated an already existing mental health pandemic. Okay, and that's pretty easy to research. The mental health hotlines are off the graph. Suicide hotlines are off the graph. And when you're dealing with mental and emotional health, I have some background in this before I ever got into the corporate world. I spent 3 years working at an agency in the inner city back in the Philadelphia area, and dealt with, you know, a lot of substance abuse, mental and emotional health, etc. So there's highly stigmatized areas, people that are struggling with these problems. They do not want the whole world to know they have them. They don't want anybody to know they have them. And one of the reasons they won't seek help is because they're afraid of stigmatization. And seeking help, okay, through the public internet ecosystem is virtually a guarantee of stigmatization. You know, so the 50% of the regimens for chronic conditions that are supposed to be adhered to are not adhered to. Okay. Now, this includes opioid abuse, diabetes, mental health, etc. Now, even COVID-19 drugs, okay, that are coming to the market. Now, how big is that problem? This is a very interesting statistic from the Surgeon General's office. The Surgeon General is estimating that failure to adhere to your prescription regimen is resulting in $180 billion a year in avoidable healthcare costs in America. $180 billion a year they're estimating. And people can do their own research on this. They're estimating that it's resulting also failure to adhere to prescription regimens as prescribed for chronic conditions, okay, such as pain, where opioids come into play, and 56,000 people died last year from opioid abuse. Okay, overall, Surgeon General is saying that failure to adhere to prescription regimen, in addition to the $180 billion in avoidable costs, it's resulting in 120,000 avoidable deaths. That's how significant the problem is. And one of the biggest areas of opportunity, in addition to mental health and emotional health and anxiety, is a simple one, is diabetes. Diabetes that is another epidemic in America. If you do the research,
it's an epidemic worldwide. We did an edition of the magazine last year on. We're going to do one again in November. John, you're absolutely right.
It's an epidemic, and even a lot of it is, see, if you look at, I'm going to give you a name of someone who speaks on this topic. Okay, his name is Jeff Korzenik. Jeff Korzenik is a lead economist for Fifth Third, one of the largest financial banking institutions in the country. Now, if you look him up, you're going to see some Bloomberg interviews that he does. And we know Jeff, he likes what we're doing because we focus on preventative education. Okay, now Jeff will say if you want to address the opioid abuse crisis in America, he uses the phrase, we must slow the pipeline. So how do we slow the pipeline? He says, you have to focus on preventative education. Now, even in my own experience, back when I was in the counseling world, people do not get up in the morning and decide I'm going to get addicted to opioids today. They blunder into it usually, okay, through lack of education, and the next thing you know, they're dependent upon it. Okay, it's a process. It's a downward spiral process. So that is an example of where prescription education and regimen adherence is vitally important. And I'm going to quote Microsoft will say that one of the reasons they like our company is if you're going to educate the American consumer right now, okay, the unfortunate reality is that the average American, okay, reads and comprehends at about a 7th grade level. Okay, now what does that mean in healthcare? Well, it means this. Anything that Walgreens or CVS or Rite Aid or Kroger or Walmart puts on the prescription bag to try to give the consumer guidance, just throw it away. The consumer,
you can't read it anyway.
It's so tiny. Can't read it, comprehend it. So in essence, okay, as a consumer, we all have gone through this. We go to the doctor, we have some ailment, and the doctor prescribes a prescription and scribbles it down. You can't hardly read it. The doctor's looking at his watch. I've got 5 more patients to see, and I'm about to ask the doctor questions about the prescription, but I'm talking to the doctor's back as they're walking out the door. I mean, my next stage in this process of education, of self-education, will be I go to the pharmacist. Okay, I go to the pharmacist, and I've got this prescription for this drug I need to pick up. Let's say it's a mental health drug. Let's say it's an AIDS drug. Let's say it's opioid abuse medication. Let's say it's cancer. And I go up, and is my prescription ready? Yes, it is. Okay, great. They give me my prescription. They're trained, because we're talking to the big pharmacies now. Okay, we're in conversations with the Walgreens and the CVSs of the world, and with the Kroger pharmacies in collaboration with Microsoft. So the pharmacist says, because they want to do a better job of educating the consumer, the #1 challenge arguably in all of American healthcare. Do you have any questions for the pharmacist? Now, I'm standing there. I don't understand this drug. I'm still in a state of high anxiety because I was at the doctor's office half an hour ago. They wouldn't answer my questions. They didn't have time. The pharmacist says, do you have questions for the pharmacist? Well, I do. Yes, I do. And I also have 3 of my neighbors standing behind me. And let's say it's a mental health or emotional health drug, or COVID-19 or cancer, or HIV. I am not going to stand there and have a public conversation with the pharmacist about this drug. I'm not going to do that. Okay, and mental and emotional health in particular, it's highly stigmatizable in the US, unfortunately. So the consumer walks away. They got their little bag in their hand. They look down at the mouse print. They can't read it. They don't understand it if they could read it. So they go home. They're in a total state of lack of knowledge. Okay. They haven't gotten it yet. Oh, I'm going to go to the public internet ecosystem. I'm going to go to WebMD. I'm going to go to the CDC website in Atlanta. I'm going to go to XYZ pharma company's public internet ecosystem website to find out more information about this mental health drug or this cancer drug. Well, guess what's happening then? You are immediately being mined. And this is the lesson, the ugly lesson of Cambridge Analytica and Facebook in 2016, and how they mine all of the data. And in healthcare, it's a big problem Because all it takes is for me to go to XYZ pharmacy company's public internet ecosystem website or WebMD or the CDC, and I start poking around about mental health drugs or cancer drugs. Okay, the bad guys, all they need is that. They will take that. They know I'm inquiring about a mental health drug. Okay. They will now merge that together with every other website that I've ever gone to inquiring about mental health drugs. They're capable of merging that together with our social media communication, where we're communicating with our family members about how'd your doctor's appointment go yesterday? You know, when's your next appointment? Anything we can help with. They're able to merge that together with the email that the clinic sent you that you opened on a mobile device, and your mobile device was Android, which means it has Gmail, and if it has Gmail, that means it's not private. They pull all this together. I wish I was making this up, but I'm not. They pull all this together. They create something called a healthcare risk profile. Aha! Now, who might be interested in paying for your healthcare risk profile? Okay. Now, let's think about this. Life insurance companies would be very interested in that and are. Okay. Lending institutions are very interested in that and are and will pay for it, because the number one reason for a personal bankruptcy in America, this is the domain of the banks that they live in terror of, okay, is I've had a bad healthcare event, a major healthcare event. I got massive bills. I can't pay them. I declare personal bankruptcy. That's what the banks are on the lookout for. What is your risk profile score? Aha. Because you just applied for a 30-year mortgage loan, or you just applied for a small business loan. Are you a good healthcare? Are you a good risk or not? Boom. That's how it all ties together. That's why it would be impossible to exaggerate our level of enthusiasm in helping to solve this problem for American consumers. And financially, with CCPA rolling out now, July 1st, and it has teeth in it, the class action lawsuits are already starting. I mean, because what's happening, the healthcare service providers that do not adequately understand this and do not take the steps to protect the consumer adequately, okay, of the risk, the public internet privacy risk from going to their website, the consumer is now going back to class action lawsuit attorneys, and class action lawsuits are rolling out. And this is just starting. So this is a very big deal. And the poor consumer is figuring this out. And that's one of the reasons why they don't know how to get help. They just really do not. And we try to address that need for the consumer and protect the healthcare service provider in the process.
This is awesome information, and thank you for painting such a clear picture of how all this is related to, you know, interconnected, if you will. I mean, I always wonder when I go to Amazon and buy a pair of workout shorts that why 10 other pair of workout shorts show up on my Facebook, right? So I'm like, how did they know this?
You just summed the whole thing up. Seriously.
I'm like, there you go. Well, this is great information.
You just summed the whole thing up. But just apply it to health. Just apply it to healthcare and mental health, and cancer, and HIV, and COVID-19. You're
I
like,
know,
wow,
this is great.
I guess everybody knows what I'm doing here on the internet.
They all know, right? So the website for Didgebridge is www.didgebridge.com.
That's correct. Yes.
Yes. Okay. We're going to put that in all the language we put around the video. So thank you, John, for this. There's other conversations I think we can have down the road, but thank you for what you're doing, for helping us to kind of get better about our regimen and understanding the importance about that, and also from the standpoint, particularly of mental health and memory diseases. That this could be the helping aid that you need. I mean, I see this living on top of telehealth. I see I see all kinds of connections here for
exactly
Didgebridge.
right.
So we're excited to have you in. So thank you very much, and we'll be back at you probably when we do the cybersecurity issue, and then maybe diabetes too. So
yeah, no, great. Hey, listen, you keep up the great work. You know, you guys, like I've said to you before, we love you guys because you're committed to doing the right thing globally and addressing major societal issues, and we're just delighted to be part of your organization, and whatever we can do to help your constituents, we're happy to do that.
definitely will be talking